Breast cancer in men is extremely rare. In fact, just 1% of all breast cancer cases occur in men, but more than 2,000 men are expected to get the disease. And when that diagnosis comes, it often makes those men feel isolated and alone. Back over to Pete now, who's going to introduce us to a male breast cancer survivor who's trying to erase the stigma attached to that, Pete.
Yeah, Vince, a stigma commonly associated, of course, that breast cancer is only for women. But Rick Williams is a stage 3 breast cancer survivor. He's had a mastectomy and 16 lymph nodes removed to treat his cancer. Rick says it's in his experience with cancer that he didn't get the same support women often do.
I think a lot of it is men are embarrassed. Maybe I got breast cancer. You know, they think of it as a woman's disease.
Rick's family and church rallied around him, and then the 58-year-old spoke at a fundraiser for the Susan G. Komen Breast Cancer Foundation.
It takes patients like Rick to get up there, to talk about his story, to raise awareness, because there could be a man right now, sitting and ignoring a lump in his breast that we could save his life because of stories like Rick. Hi. How are you?
As a 9-year breast cancer survivor, Rick still takes medicine, gets exams and blood tests twice a year, and feels no embarrassment talking about his breast cancer, especially to other men.
Everything feels good.
Men should examine themselves for a painless lump or thickening of breast tissue, any changes to skin or size of the breast.
Men can get breast cancer too, and so men can die from breast cancer, more importantly.
And because early diagnosis and treatment are key to fighting breast cancer in women and in men, Rick wants a lot more blue in the sea of pink.
The American Cancer Society estimates 2,500 men will be diagnosed this year alone from breast cancer, and about 500 men will actually die from it. We want to show you a couple of factors that increase your risk. They are older age, if you have the BRCA2 gene mutation, or a family history of breast cancer, also if you're overweight or obese.